Okay, good morning, internet audience. Hello, world. So today, I'm Dr. Rucker. Today I'm going to do a video describing a very personal, embarrassing sometimes, worrisome and stressful condition that I've helped many patients with, and that would be a viral condition called herpes. Specifically, we have treated several patients over the last 3 or 4 years with genital herpes. Genital herpes can be either HSV-1 or HSV-2. That's the virus that is associated with herpes outbreaks. So I have a list here of 5 patients I've treated. I've changed their names, their ages, everything, but I didn't change the clinical facts of their condition, and that's why I'm making this video. I'm very pleased and proud to present the data that we've assembled over the past 3 years on these patients. Generally, the modern medical model, if someone has herpes, they go to see the doctor, they get laboratory tests, and they find that they're permanently diagnosed with herpes and they have to permanently stay on medicines to suppress outbreaks. Well, we've been able to get patients off their medicines and prevent outbreaks, which I find quite remarkable, and I want to share that. The fundamental treatment that I use to do this is ozone. So patient 1 I treated 3 years ago. This patient came in for a series of 8 ozone treatments every week. He followed my dietary protocol, he followed my supplement protocol, and I followed up with him a few months ago, and he's completely rid himself of all his outbreaks. He has a stable relationship, no one has any outbreaks. His titers did go to 0. Some of the patients have viral titers that go to 0 on follow-up. And I'm very pleased to see he's completely free of his herpes 2 infection that was genital. He was a man, so it was on his penile region. And he's completely free and in a good, stable relationship that he's happy with, and neither one of them are getting any herpes outbreaks. So he went through our treatment protocol. Patient 2 is an executive who I treated about 2 years ago. This patient is also completely free of all outbreaks in a stable monogamous relationship. And these 2 patients, one was an entrepreneur, one was an executive. They're very good historians because they understand medicine and the physical exam and their symptoms. So it's really beneficial when I get the feedback from reliable patients. So once again, another example, the protocol working great. Patient 3, waitress we have, she's a younger patient, came in with outbreaks genitally, complete resolution of symptoms. I believe she had 6 weekly treatments. Patient number 4, one of our patients, I've known this patient for 6 or 7 years, and then this patient drives for a trucking company. And I remember, I'd say it was 2 years ago, the patient confided with me, even though I'd been his friend for 6 years, he confided that he's always had, outbreaks of herpes and been on medication. And the medication was starting to cause dysfunction to one of his organs because of its side effects. So he had seen some of my other videos and information, and I did a series of weekly ozone infusions on him. We didn't really do a whole lot because he stopped his medicine, and completely 0 outbreaks. And he was getting outbreaks on a regular basis despite being on the medicines that suppress. And patient 5 is another patient who we've gotten to know very well over the past year. Very intelligent patient. He's also software style industry, tech industry. He was getting symptomatic outbreaks, and he's a pretty intriguing patient because his HSV titers were high. He's been one of my most loyal, religious patients, been coming in religiously, I want to say for 2 or 3 months. If you take a protocol and tell someone it's 6 weeks, this guy wants to do it for 12. He's that aggressive. And I found his outbreaks are 0 now, and very, very interesting is his titers have gone to 0 also. And our next step with him is the highest, most ultra-sensitive test he wants to do is called Western blot, where they actually take the patient's blood and look to see if the virus is in the bloodstream. it's not even an antibody test. So it's the most high specific sensitivity test that we specially do at our office. So what is the conclusion of this information I'm presenting today? That the modern conventional medical model says that herpes is incurable, that you're stuck for life with it, and patients are so confused, they're embarrassed, they don't know what to tell their next partner they're going to be intimate with. And what I'm saying is we have an amazing solution for this problem, and it rests with our ozone therapies. And I combine ozone, intravenous vitamin C, teach people certain supplements, and we're seeing phenomenal results. So that's why I wanted to share this to the public. And if you'd like to know more about it, our number is 941-448-1199. I'm Dr. Rucker, and we love getting people feeling better and making them happy. Thank you.